Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's talk knees for a moment. It's kind of staggering, but globally, something like over 595 million people are dealing with knee osteoarthritis. That pain, the loss of function, it's a lot.
It really is. A huge number.
So if you're listening, and that includes you, and maybe you're looking for something beyond just, medication, what are the options?
Well, that's exactly what we're diving into today.
Yeah, today on the Deep Dive, we're tackling a really interesting question that came up in recent research, comparing exercise types, specifically yoga versus more traditional strengthening exercises for easing that knee osteoarthritis pain.
Exactly. We're going to unpack a specific study that put these two head-to-head. We'll look at what they found and, importantly, what it might mean for managing knee health day to day.
And to make sure we're getting the full picture, we looked at a couple of things. There's a health news article summarizing the study, giving us the highlights, sort of.
Right, the quick overview.
But we've also gone right to the source material, the actual research paper. It was published in JAMA Network Open, so we've got the nitty-gritty details, too.
Good idea.
Yeah.
Always best to check the original study.
Our goal here is really just to break down this research, make it understandable, so you can figure out if yoga could be a useful part of your plan for managing knee pain.
Absolutely. So let's get into the study itself. What was the main goal?
What were they trying to find out?
Well, the researchers really wanted to directly compare yoga and strengthening exercises. They aimed to see if one was significantly better than the other at reducing knee pain over a 12-week period.
Okay, and who were they studying?
They focused on adults aged 40 and older, all of whom had diagnosed knee osteoarthritis, and critically, they had to have a certain level of pain to begin with, a score of 40 or more on a 100-millimeter visual analog scale.
Ah, the pain scale. Can you remind us how that works?
Yeah, it's pretty simple, actually. Imagine a line, like a ruler, 100 millimeters long. 0 at one end means absolutely no pain, and 100 at the other end means the worst pain imaginable. Participants just mark where their pain is on that line.
Got it. So how did they actually run the comparison? What was the setup?
It was what's called a single-center, parallel-arm, active-controlled, superiority randomized clinical trial. A lot of jargon there.
Whoa, yeah, break that down a bit.
Okay, so single center just means it all happened in one place. Southern Tasmania, Australia, in this case. Parallel arm means that the two groups, yoga and strengthening, did their exercises at the same time over the study period.
Okay.
Active controlled is important. It means they compared yoga to something already known to be helpful strengthening exercises, not just to, say, doing nothing or a sham treatment.
Makes sense. And randomized.
That means participants were randomly assigned, like flipping a coin, to either the yoga group or the strengthening group. This helps make sure the groups are pretty similar to start with, which makes the comparison fairer. They were hoping to show one was superior, hence that term.
Okay, that clarifies things. So who were the participants and what did they actually do each week?
Right, so they recruited 117 people in total, pretty evenly split. 58 ended up in the yoga group and 59 in the strengthening group.
And their routines.
For the first 12 weeks, both groups had the same schedule structure. 2 sessions per week were supervised by professionals, and then they also had 1 session each week to do on their own at home.
Okay, so a mix of guidance and self-practice.
Exactly. And after those initial 12 weeks, the supervised sessions stopped, and they were asked to continue with 3 home-based sessions per week for another 12 weeks. So 24 weeks in total.
And they kept tracking pain using that visual analog scale throughout.
Yep, that was the main thing they were measuring, the primary outcome. How much did that pain score change from the beginning to the end of the first 12 weeks, and comparing the change between the two groups?
But you mentioned they looked at other things too, right? It wasn't just pain.
Correct. They wanted a broader picture. So they also measured secondary outcomes, things like physical function, how well people could do daily tasks, knee stiffness was another one, and also overall quality of life, and even mood, specifically looking at symptoms of depression.
How did they measure those? More scales?
Pretty much, yeah. They use well-established questionnaires. There's one called the Western Ontario and McMaster University's Osteoarthritis Index. Bit of a mouthful.
Yeah.
It asks specifically about pain, stiffness, and physical function related to osteoarthritis. They also used something called the Assessment of Quality of Life 8 Dimensions and the Patient Health Questionnaire 9, which is commonly used to screen for depression.
Okay, so a pretty comprehensive look. After collecting all that data for 12 and then 24 weeks, what did they find? What were the big results?
Well, the headline finding, looking at that main goal pain reduction over the first 12 weeks, was that both groups got significantly better. Both yoga and strengthening led to noticeable decreases in knee pain.
Both worked.
Okay.
Was one better than the other?
That's the interesting part. When they compared the average amount of pain reduction between the yoga group and the strengthening group, the difference was tiny, really small, like negative 1.1 millimeters on that 100-millimeter scale.
Wow, that sounds negligible.
It was. And statistically speaking, that difference was not significant. It could easily have just been due to chance.
So in the short run, for just pure pain relief, it seems like a draw.
Pretty much, yeah. And related to that, the researchers also did what's called a non-inferiority analysis.
What does that mean?
Basically, they set a limit beforehand, a margin saying how much worse could yoga be than strengthening before we'd consider it clearly inferior. They decided on a 10-millimeter difference on the pain scale as that margin.
Okay.
And the actual difference, they found that tiny 1.1 millimeters was well within that margin. So they concluded yoga was non-inferior to strengthening for pain relief. Wasn't significantly worse.
Right. So yoga holds its own against the standard approach, at least for pain in those first 12 weeks. What about the other things they measured, like function, stiffness, mood? Any differences there at the 12-week point?
Looking at those secondary outcomes after 12 weeks, only one showed a statistically significant difference.
Which one?
Depression. The participants doing yoga reported a greater improvement in their depression scores compared to the strengthening group.
Interesting. A potential mood benefit from yoga then, early on?
It seemed that way at 12 weeks, yes.
And did these findings change when they looked out further to the 24-week mark? Did the effects last? Did anything else emerge?
Yeah, things shifted a little bit when they analyzed the 24-week data. Over the longer period, the yoga group actually showed slightly greater improvements in several areas compared to the strengthening group.
Oh, really? Like what?
Well, they had better scores on that Western Ontario and McMaster University's Osteoarthritis Index for pain, for function, and for stiffness. Modest improvements, but statistically noticeable.
Okay, so some advantages for yoga seem to kick in later.
It appears so. They also reported a better patient global assessment, basically, how they felt overall about their condition. And they performed better on a walking test, the 40-meter fast-paced walk test. And their quality of life scores were also slightly better in the yoga group at 24 weeks.
What about the depression finding? Did that hold up?
Interestingly, no. That significant difference in depression favoring yoga at 12 weeks. It wasn't there anymore at the 24-week follow-up. The effect seemed to fade, or maybe the strengthening group caught up. It's hard to say exactly why.
Okay, so stepping back from the specific results, if someone listening has knee osteoarthritis, what are the main sort of practical takeaways from this research?
I think one of the biggest things is that this study gives pretty solid evidence that yoga can be a really effective tool for managing knee OA pain. It's not just, wishful thinking.
It puts it on par with strengthening, at least initially.
Exactly. For short-term pain relief, it seems to work just as well. And that's huge because it offers people another evidence-based, non-drug option. Maybe strengthening exercises aren't their cup of tea, or maybe they want to add something else in. This gives them that choice.
And it sounds like yoga might offer something, well, broader, more holistic, perhaps.
That seems to be the suggestion, especially from the longer-term findings. Those modest advantages in pain, function, stiffness, even quality of life at 24 weeks, they might be because yoga isn't just strengthening.
Right. It involves flexibility.
Flexibility, balance, but also potentially mindfulness, breathing techniques. It addresses things in a slightly different way than just isolating and strengthening muscles.
And that early blip with improved mood in the yoga group, even if it didn't last significantly, is still noteworthy, isn't it? Especially with chronic pain.
Absolutely. We know there's a strong link between chronic pain conditions like osteoarthritis and things like depression or anxiety.
Yeah.
So any indication that an intervention might also help with mental well-being is definitely a plus point worth considering. Even if temporary, it suggests a potential added benefit.
Did the researchers themselves comment on how this might change things, like for doctors or physical therapists?
They did. Based on these findings, they suggested that integrating yoga into clinical practice could be really beneficial.
How so?
Well, clinicians could feel more confident recommending yoga, perhaps as a solid alternative if someone isn't keen on strengthening, or maybe even as something to do alongside strengthening exercises. It just adds another validated tool to the toolkit.
Of course, we always have to talk about limitations. No study tells the whole story. What are some caveats here?
That's crucial, you're right. Firstly, it is just one study. A
Yeah.
well-designed one, yes, but still only one piece of the puzzle. More research replicating this in different places with different groups is always needed to build confidence.
Good point. And was the yoga itself kind of specific? Could someone just go to any yoga class and expect the same?
Probably not, no. That's a key limitation. The yoga program used in this trial was specifically designed for people with arthritis, and it was delivered by experienced yoga therapists who understood the condition.
Ah,
So the results you get from a, say, general power yoga class at the local gym might be quite different. It might not be suitable or even safe without modifications. The tailoring seems important here.
what about the participants themselves? They were all from one area, right?
Yes. All recruited from southern Tasmania in Australia. So, things like the local environment, maybe typical activity levels, access to healthcare there, these could all play a role. We have to be a bit cautious about assuming these exact results would apply perfectly to, say, people in North America or Europe.
Fair enough. And one more thing, doing exercises at home. How well did people stick with it? Does that affect the results?
It's always a factor in studies like this. Interestingly, they did find that adherence to the home-based yoga sessions was actually a bit better in the later weeks compared to the home-based strengthening sessions.
Oh, that's interesting.
It is. Maybe people found the yoga more enjoyable or easier to stick with on their own. But still, unsupervised practice is always variable. Some people are great at it, others struggle. So that variation in adherence could influence the outcomes we see.
Okay. So despite those limitations, it still sounds like this study adds quite a bit to our understanding.
I think so, yeah. It provides valuable information. Showing yoga as non-inferior to strengthening for short-term pain is a significant finding. And the hints of broader, longer-term benefits for function, stiffness, and quality of life are definitely thought-provoking.
It really reinforces the idea that there isn't just one right way to exercise for knee osteoarthritis.
Exactly. It empowers patients and clinicians with more options.
So for everyone listening, especially if you're navigating knee osteoarthritis pain, the message seems to be both yoga, the right kind, mind you, and strengthening exercises can help reduce pain. That's good news.
Definitely.
And there's this intriguing possibility that yoga might offer some extra, perhaps modest perks down the line for how well you move, how stiff you feel, maybe your overall quality of life, and potentially even mood, at least initially.
That sums it up well. It's about finding what works for the individual, what feels good, and what you can stick with.
Which leads us to a final thought, really. Given that both these approaches can help, and yoga might bring these other potential benefits, it kind of makes you reflect, doesn't it? What parts of your own health, beyond just the pain number, are you trying to nurture as you manage this? Is it mobility, stiffness, mental well-being?
Yeah, that's a great question to ponder.
And knowing this, would exploring a tailored yoga program, maybe one designed for arthritis, be something worth looking into? Perhaps alongside what you're doing now, or maybe as something new. It seems like a conversation worth having with your doctor or your physical therapist.
Definitely.
Just consider what those noticeable improvements in pain, quality of life, maybe even mood could actually feel like for you. What would that change in your daily life? And what feels like the most important next step for you to maybe explore these options?
Thanks for tuning in to the Health Headliner podcast by To Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.